Hello everyone. Today we have Dr. V K Bahl, who is Director of Cardiac Sciences, Professor and Senior Consultant Cardiology, Ramaya Memorial Hospital. Thank you so much, sir. Thank you so much for coming with us.
Thanks for inviting me.
So, to begin with, my first question for you would be why addressing heart diseases is important in India?
Good question. Many people ask that we are a country where malnutrition is a problem, malaria is a problem, unsafe pregnancies is a problem. But you should realize that one third of that 33% of deaths in a survey in Andhra Pradesh village were due to cardiovascular diseases. So looking at the sheer numbers, we should be focusing on these lifestyle related diseases or non-communicable diseases. The time has come. We are almost in epidemic phase of diabetes and coronary artery disease.
So, since you just mentioned a few examples about like cardiac deaths in Andhra Pradesh, are Indians more prone to heart diseases?
Very good questions. There was a very large study in 54 countries called InterHeart, and they found out that the risk factors, the same traditional 9 risk factors which we all know, hypertension, diabetes, cholesterol, etc., are same all over. But we get the heart attacks a decade earlier. Now we are seeing the heart attacks in second and third decade, which is very alarming. And we have not been able to focus why these are happening. One thing is that there is a stress, there is unhealthy food, there is a lack of exercise, there is a diabetes which is increasing, the smokers are increasing. Those risk factors are traditional, but they are occurring at a younger age. So we have to stem this epidemic because we cannot afford to treat all these patients. We have to prevent it.
So, since you mentioned that Indians are prone to heart diseases a decade earlier than the rest of the
Yeah.
world, what could be the factors? You've mentioned some lifestyle factors and some
See, but
habits.
these are the traditional factors which are all over the world. They are the same factors, but they are occurring at a younger age. So, are there any special risk factors? Which lot of studies have been done, starting from the genetic studies, starting from the role of an infection or inflammation. Are there some risk factors like lipid LPA levels which are different in Indians? So, all there are ongoing studies, but it's a fact that it is occurring at a younger age.
So, how has cardiac sciences advanced in the last few years in India?
Oh, the problem of India is because of sheer population that we have two worlds. One is India, one is Bharat. I tell it traditionally
Okay.
because there is one set of corporate hospital which everything is available, which is available in the Western world. There is no technology which is not available in India. But affordability and availability is the problem. So there is a large population which is deprived of even the primary or secondary health care. With coming up of the Ayushman schemes and etc., now the healthcare is going to the 2 tier and 3 tier cities, which was restricted to the metro cities. But if you ask me the technology availability, it's anything which is available in the Western world is available in India.
Since you mentioned technology, what will be the role of technology in a country like India in addressing cardiac
It's
health?
a very good question. We should not be slave to the technology. That is the first thing. We should be cost effective. Like coming to the coronary artery disease or heart attack, which is commonly known. It is because of obstruction in those three coronary arteries which happens. Traditionally, we have been doing the angiography, which is an invasive procedure. We put a catheter in the heart and look at the coronary arteries. Now we can go beyond that angiography and know whether that obstruction is leading to ischemia, less blood supply to the myocardium by a technique called FFR. Then there are imaging techniques, intravascular ultrasound or OCTs, which can look at that plaque, whether they are vulnerable to rupture or not. Similarly, the non-invasively CT angio has come in a big way, which is not an invasive, but it gives you as accurate a result as coronary angiography. Similarly, there are the technologies like smart watches are example, which can pick up the arrhythmias, which occur very infrequently. So there is a tremendous growth, but we should always remember there is always a possibility of a failed technologies, and there is a cost to it. So we have to use it judiciously in our country where the cost effectiveness is a very big factor.
So, if you could just elaborate on some newer developments that are changing how heart diseases are treated.
See, now more and more heart diseases are being treated percutaneously. That means we don't have to cut open the chest. That is the major thing. It started with the balloon angioplasty in 1976. We know then stents came. Now, in the field of coronary artery disease, almost all types of obstruction are being treated percutaneously. You don't require bypass surgery to be done. In the field of, say, hypertension, we only know about the medicines. Now there are technologies which is called renal denervation, which if you perform, you can take care of the blood pressure. Similarly, in the field of arrhythmia, there are various type of pacemakers available which are leadless. You need not have a pacemaker which have a lead going to the heart. So they are called leadless pacemakers. There are devices which have been put for the patients which have a heart failure. So in all fields of cardiology, there are tremendous advances which are happening.
So, and if you could quickly also touch upon the role of robotics in cardiac surgeries.
See, robots give you a precision. That's all what they do. Even in the field of cardiology, like angioplasty, the robots are available which can do the angioplasty. The exciting field is if we use this, like it has already been done, it's not a dream, that we have used the 5G technologies and the robots to remotely perform angioplasty. Suppose the patient is in a city where the cath lab is there, but expertise is not there. You can remotely do those. So those technologies are there. But I'll still tell you, we cannot treat this number. So we have to have the mantra of prevention, which is traditional, which I say ABCD. Avoid smoking, blood pressure, B for blood pressure, teach no, 8 for apple, teach A, avoid smoking. These children, the problems are happening at that age, adolescent age. Obesity, they are playing cricket in the computers, they are using the language of emoji. So treat them. A for avoid smoking, B for blood pressure and your body weight, C for cholesterol, D for diabetes, E for exercise, F for food, and G for go to your doctor annually. No?
Thank you, sir. Thank you so much for your time.
Welcome.
Thank you.